morning, everybody. We are about ready to start, and since it's already a few minutes after 9, I would like to get rolling now. So I have the very great pleasure to introduce today's keynote speaker. She's sitting here. It's Professor Claudia Angelelli. Professor Angelelli has a very broad international, also very interdisciplinary background. She holds, to start with the international part, she holds degrees from Argentina and the US, both from Monterey and Stanford, and she's now based in Europe, where she's chair in multilingualism and communication at Heriot-Watt University, so Scotland. She is also a professor emerita at San Diego State University and a visiting professor at Beijing University of Foreign Studies. And her research is as broad as her international background. It sits at the intersection of social linguistics, applied linguistics, and translation and interpreting studies. So interdisciplinarity is a keyword for Professor Angelelli's work. In our context, or at least from my perspective, this must be me, this could be me, but she is perhaps most well known in the area of interpreting studies, where she has contributed extensively to community interpreting and has an absolutely leading role in the field of medical interpreting. She has published, of course, extensively and brilliantly in so many outlets that I cannot mention them all, but her main works are 3 single-authored books, but she has many. There is Medical Interpreting and Cross-Cultural Communication from 2004, and also a more recent one, Medical Interpreting Explained, published in 2018. But I think that especially the book Revisiting the Role of the Interpreter, which came out in 2004, is widely cited and ever topical. And it's actually no small feat for a book to be reviewed again almost 15 years after its publication, as it recently happened to Revisiting the Role of the Interpreter from 2004. Then, keywords for Professor Angelelli's work. It's international, it's interdisciplinary, it's empirical studies that have an impact that matter. But Professor Angelelli is also committed. She's engaged in everything she does. Apart from being a scholar with a stance, she is an engaged practitioner, teacher, and contributor to the community as well, to the professional field. She has, for example, led the work on the ISO standards on community interpreting and co-authored the very famous California Standards for Healthcare Interpreters. So through her work in all its facets, she has done her bit to debunk the myth of the invisible interpreter. Professor Angelelli, we look forward to some of that commitment in the keynote address that you are about to give. And we don't mind strong opinions. They sometimes unsettle our foundations for a while, but allow us to grow stronger and wiser in the long term. So we look forward to hearing your talk on minding the gaps, translation and interpreting studies crossing interdisciplinary boundaries. So I'll give the floor to you. We're looking forward to it.
Thank you very much, and thank you, Helle, for that really kind introduction. I want to also thank the conference organizers for this kind invitation. While putting together thoughts and a paper to present, I thought, how do we talk about translation, interpreting studies in the times we are living, and I think Helle did a wonderful summary of the areas in which I hope I'll be touching during the presentation. So here's an outline of the talk, a very ambitious one, but I timed myself, and I hope I'm not rushing, but you do let me know, as we do with speakers when we put up our hands, slow the pace, and we can interpret better. I want to talk about borders, language, contact, and communication. I think it's looking at translation and interpreting as a form of communication where we all come together in translation and interpreting studies. But I will focus in translation and interpreting in the community. And I will focus on that as a situated practice, so exploring what makes translation and interpreting for the community different than other types of translation and interpreting. And for that, I will dive into conceptualizing the part of interpreting in this keynote, as we had a wonderful keynote yesterday that paved the way to this one in already discussing interculturalness and otherness and whatnot. And I will show some examples from one study, but I will give you a sense of how studies can come together. And then we'll discuss the current need for reliable community translation and interpreting, the role of language industry and other disciplines, how we can support and lead with expertise. And why not? We'll look at the future and how that collaboration can happen. So what I would like to do is to first ask us to think along a continuum throughout this presentation, so that it's not either or, but it's everything that happens in between that we also need to consider. And that we focus on concepts we know and we think about them in other ways. So very relevant to translation and interpreting studies are issues of borders, language, and communication. So when we look at borders, do we look at borders and consider them as necessary, porous, obstacles, permanent, physically, socially constructed? When we think of language, is it stable or is it unstable? It changes over time. Does it make sense to talk about a mother tongue, a native language, a first language? Are we thinking spoken language, body language, sign language, written? And when we think about communication, are we thinking translation and interpreting in one-to-one, in one-to-many, written, oral, signed, intercultural communication, and are we accounting or ignoring social factors? Those would be ends of a continuum, and I want to visit what happens in the in-between. So now it's the time when I want to go to video one and just to make sure we're all up and enjoying the presentation. You will enjoy this a lot more than my talk, I think. I hope. Where's your volume? It's all the way up there, and now we need it up from the video, I think. Look at the volume. There it is. Look at the volume. I think you need to raise it from here.
It's on the most biggest one.
We're having an issue with volume. Well,
does it work on here? No.
Can we just show it anyway so that we don't...
Is it okay?
We don't need the volume that much if we can. Just give the volume the max and go.
Okay.
This is all you can do. Is this? Yeah, that's not. No. Well, it doesn't matter. Yeah, you think you can?
No? Okay. Jag tycker nog att jag
It's maximum in both.
Mm-hmm.
Well, the story goes we need an interpreter. We don't have one.
Lite oververkning.
Lucy is accused of, well, I'm not helping, I'm not helping.
Yeah, I'm sorry, that's... Okay, that's the loudest it's going to go, but if we are really quiet, we should be able to hear it. So let's try that, but that's the loudest it's going to go.
Focus on body language, otherwise, that's a possibility.
Okay.
So there's a prisoner that speaks Spanish, and two officers that speak French and German. Okay, now I'm too loud, I'm afraid. Were you able to enjoy the video with little sound? But we got an illustration of all the characteristics of language that we just discussed, and we saw them at play. So, community interpreting, community translation is a situated practice, which means it's really difficult to transfer blindly standards and methods of teaching interpreting, testing interpreting, discussing interpreting or translation across different settings. So this has been proven in literature, so I always say don't take my word for anything, but it's just coming out of research, how we have seen how a situated practice differs and the characteristics of it. So we've seen speech communities, we've seen interpreters navigating different speech communities in different ways and with different strategies. So in order to understand how interpreters work and interpreting is conceptualized, let's look at how we have thought about interpreting as talk, as text, as interaction. So let's look at an example on when interpreting is considered text or interaction. And the example is the following. It's taken from Badenshaw 1998, the book on interpreting as interaction, and one of mine in medical interpreting as cross-cultural communication. What you see in there are embedded dialogues. So in the first one on the left, a legal setting where the judge saying, so you don't confess the theft. And there's this embedded dialogue between the interpreter and the suspect, where it is, that is, you don't confess the theft. Yes, the suspect says, and the interpreter gets back to the judge and says no. So if we look at those bold ones, it makes sense, and there are, as we all know, different ways of saying the same thing. For people who are monolingual and may know the difference between yes and no in the other language, they are always surprised. I can talk eloquently about the second one in medical because I was collecting this data. So when the doctor was asking the patient, is your eating okay? The interpreter turns to the patient and says, any problems eating? No. And so the interpreter turns to the doctor and says, yes. And the doctor's answer was, come on, I understand that. I can order beer in Mexico. And she said, no. So why are you telling me yes? So this idea that the end user, the client, not knowing the two languages may have about things are linear and you need to bring every single word to me, makes us reflect on how interpreters are conceptualized, how people think about interpreters as conduits, as enablers of communication, as co-participants in the interaction with agency. So very briefly, again, going through the literature in the different models that were portrayed about interpreters. The linear model, what I call the linear model, really in line with Reddy's theory of communication, the interpreter is perceived as a channel or a conduit, so bringing very little to the interaction and just switching languages. So this is in line with earlier writings on conference interpreting, where interpreters were, yesterday I was in a wonderful presentation where we were reminded of how interpreters were taught before, and teachers would say, you know, you just don't exist. The best thing that could happen is when people don't even notice you are there. And I think that without the interpreter, really, and hardly any conference would go by. So it's very sad to tell our students this is how you think of yourself, rather than you have abilities and you're a very powerful agent, and in this particular setting your job is to do X, Y, and Z to help communication, for example. So students may become aware of their role and their responsibilities. Research crossing over from sociolinguistics, so this is where we start the interdisciplinary game, showed us that interpreters are addressed at talk and also take part during talk. Therefore, it's hard to imagine that somebody that gets addressed at talk or takes part can be invisible or can be just non-existent. This research comes from, I've quoted in there, Berg Seligson working in legal interpreting, Melanie Metzger and Cynthia Roy from sign language interpreting, working in Melanie in hospitals and Roy in educational settings, and Badenshaw that we have just seen in from Swedish to English and other languages. So their research showed that, for example, during interactions, it's not uncommon for one of the speakers to address the interpreter and says, tell her that, right? Becoming a co-participant, taking part in that interaction, or For example, controlling the traffic of communication and telling somebody who's about to overlap or interrupt, wait a minute, let me finish first and then you talk. So again, co-participants coming together. And in addition to taking part in the interaction, to being addressed at talk, we also are curious about what triggers the interpreter's participation. When is it that that agency gets activated? And I'm going to suggest a theoretical framework through which we can look at this issue. But of course, I'm also humbled and reminded by Wittgenstein that, we may or may not accept the use of multiple lenses, and we don't know what our IPs, but it needs to fit our views and our eyes. So the first set of lenses that I propose is a lens of social theories, where we see the interpreted communicative event at the level of institution and society. So what are those cultural norms, societal blueprints that we all bring with us when we interpret or when we don't? So we are framed and we have certain beliefs simply because of who we are and how we grew up. The lens of sociological theories help us look at the interpreted communicative event at the level of interpersonal relations. So how relevant is the interpreter going to become to the other and the other to the interpreter? It will depend on the length of the time that we will be working together. The many assumptions that we may make about each other based on social factors is going to color, in a way, how we are going to behave, unless we know how to handle those variables of social factors. And finally, the lens of linguistic anthropology, which is the one that will help us look at the interpreted communicative event at the level of discourse. So the level of society gives us our cultural baggage, who we are, our habitus. The sociological theories help us understand how we interact with each other. These things happen in interpreting. And the lens of linguistic anthropology helps us look at words and see what they mean and why they mean certain things in presence of others. And the example I can give is a singer that was hired to sing for a wedding anniversary. So the singer is poorly paid and resents being poorly paid, and he cannot think of any other way of getting back at this issue than overpraising the couple that's getting married. So he starts singing in this small village, a Wolof village, and when that overpraising, when he starts saying, you are the king and queen of the village, only becomes an insult when the neighbors are there. The neighbors know that they are not the king and queen of the village. And so the presence of the other affects how one perceives a message. So if this helps to look at the interpersonal role of the interpreter, this is what a visible model may look like. It means taking into account issues such as affect, age of the parties, ethnicity, gender, nationality, power, race, socioeconomic status, solidarity, among others. But we look at that interaction in the middle. This is where the interpreter is, and there are layers of pressure brought by the institution. We are here in an auditorium in a university, and I'm supposed to be a keynote speaker and speak to you in this way. If we were having coffee, the interaction would be very different. This is imposed on us by an institution, and all of us are coming from different backgrounds where we may hold a lecture in this way or in very different ways. I remember my days in California where, we can go on flip-flops and hold a lecture, or, our students were calling us on first names and whatnot. Those are things that are done in a way in one country and in a very different way in another country, perhaps. And the idea is that the interpreter, as well as the parties, they are not immune to all these social factors that are permeating every layer of this interaction. That's why we talk about an interpreter with agency, a visible interpreter, and that doesn't mean anything to do with the physical visibility. Sometimes interpreters are present, sometimes they are acting remotely on a video conference, for example, or on the phone. So, enough about how we have been conceptualizing interpreting these days, and let's look at current issues that increase the need for community interpreting and translation, and how, if they vary through past, present, and future. Today, as in the past, Geographic displacement of big or small groups of people has linguistic consequences. That's a fact. People moving or being displaced as a result of all these things that you can see on the screen increases the need for communication. And the need to communicate among people who do not share languages has always required translation, interpreting, maybe by another name, like language mediation, brokering, any other types of language support. So this has happened in the past, and it happens today, and will continue to happen. But today, and like in the past, people's displaced and the need for communication has reached an all-time peak. We cannot shy away from that when we look at all the issues of migration that we see around the world and refugees. It's an all-time peak. We also have today developments in technology that have increased our ability to communicate remotely and immediately. So we have a lot more of that communication happening. And consequently, when we have a lot more need that can be supplied with technology, the need for reliable human or machine-assisted language support in the form of translation, interpreting, or mediation has increased. So this is what's different today from the past. So an increasing need for reliable community interpreting and translation raises the question, who's acting as an interpreter or translator? So when we look at ISO standards for practice on community interpreting, they refer to a professional as somebody who holds one of these three, either a degree, a certification, or experience in the field. There are countries that don't have certification. There are many that don't have a career in community interpreting or public service interpreting or a degree. And there may be courses, there may be workshops, and so saying people have to hold a degree made it very difficult when we were in an international forum to bring all the participants and level the playing field. But we also have what we call non-professional interpreters or translators that are acting as interpreters and translators, maybe on the basis of their bilingualism, on knowing two languages, or on having had family experiences. It's a case of friends and family members, including children. So I'm not advocating for or against this. This is reality. When we walk into hospitals, we walk into prisons, and this is what happens when we are asking for degrees. We don't have everybody showing a way of being certified, and it's happening. Here are some terms that are used to refer to people who are acting as interpreters and are not professionals, and I let you read through those. And there's research supporting each of these categories. But I want to look at translation and interpreting studies, language industry, and other disciplines to really look at how we interact. And what we see in there is that there's immediate need and increased need to access services on the part of linguistic minorities when we think about displacement, for example, and there's also a need to access information, and for that, translation and interpreting is the answer. There are also market needs that are increasing for the pressure, the increasing numbers that I mentioned before, and that means the supply and demand of language services, there's some tension in there where we don't have enough to provide for the needs. And I highlighted quality, and I highlighted linguistic as well as TNI expertise taken at face value, because this is what happens when we have to meet a need and there is no time or no awareness or no knowledge about the need to measure quality, or simply disregarding quality for the sake of meeting a need or earning money. So we also look at non-professional translators and interpreters' remuneration and educational background, and how they interact, if at all, with professional associations and academia. And that brings us, like in any time of crisis, challenges and opportunities. We know how to educate students that can spend the time but what do we do with a workshop of refugee camps that are asked to interpret and they cannot? What is enough, if at all? This is a challenging question. I wanted to go back to the idea of border, and I wanted to discuss the notion of borders that we experience as we translate or interpret when we look at the border between the self and the other, as the case of, for example, young interpreters that may be socialized in the language of society and are the first ones to open doors for the family. And we have read and studied about the many, many issues that this raises in communication when they are children, when they are minors, when they have to focus on other things like their studies too, but they also grow up, and this is where this habitus and societal norms and cultural blueprints plays a role. They grew up helping the family. So when we get heritage speakers into our interpreting classes, for example, we first have to question their conceptualization of interpreting that seems to be helping my family versus looking at how I can portray a message in a different culture without that pressure of the helping, for example. We can also look at borders between the self and the other across a border. And for 15 years, I have the privilege of working at the Tijuana-San Diego border, which is a very interesting place to work, and see how a language like Spanish, for example, that is not a foreign language in the United States. The Hispanic population in the United States it's over 60 million, so we cannot talk of a less commonly taught language. But however, in places like that, we still may not have a professional interpreter acting, and the consequences are catastrophic, and we have those in press. And I also worked across borders, so the self and the other in cross-border lands, and I very briefly want to mention some results that have to do with quality and who is the person interpreting. In this study entitled Public Service Translation in Cross-Border Healthcare, the report is available, so I'm just going to very briefly give you a snapshot of what happens in cross-border healthcare in Europe, given that we are in the European Society for Translation. So I thought this would make sense. This study was conducted in 9 months, and there were very strict limitations in budget and timeline. But here's a flavor of the cities and towns per member state, these 5 member states that were surveyed and studied. A total of 128 sites were visited. 207 informants participated in this study. 45 surveys were sent to administrators, and you may wonder why such a low number. Simply because we were not sending surveys, we were tracking the director or the administrator of the hospital where interpreting or translation was required, and we wanted that person, that responsible person, to answer. And also 290 surveys were sent to healthcare providers in all their, you can imagine, from nurses to surgeons, etc., and providers of translation and interpreting services. So for you to take a look, of the 128 sites, those were from National Ministry of Health, the national contact point of the EU, regional ministries of health, policymakers' offices, lawyers' offices, consumer rights and NGOs, community centers, hospitals, healthcare, private healthcare centers, and public ones, rural areas, translation and interpreting professional associations, software developers, translation and interpreting agencies, and cultural mediation agencies. So all of these were part of the 128 sites visited and observed. And in terms of participants, you can see the list of all the people working in those different bureaus and organizations that were visited and interviewed. The important thing for us here when we discuss quality, we discuss how translation and interpreting occurs, are the following details. When we ask who provides language services for you in all these 128 sites, you can see the dark blue line, I don't know, that's the answer. You can see the dark gray, paid full-time interpreting staff as well as private sector agencies. The light gray, volunteer services as well as private sector agencies, and the light blue, only private sector interpreting agencies. So you can get a sense of administrators and end users, perhaps the most frequent value reported is they don't know who's providing these services. They don't know about credentials or quality. So the question was put, do you use ad hoc solutions, including family members, children, staff, bilingual staff that you have in premises? And the most frequent value is yes. That's the light blue bar. And in terms of how would they rate the language service provided, again, the light blue highly effective, the light gray bar adequate, the dark gray inadequate, and the dark blue flawed. So again, I don't make any justice to the study in talking so briefly about it, but it gives us a flavor of what happens with quality and what happens with services that we know exist. We have some expertise in those, don't we? And so the conclusion of the study, it's pages and pages, but I just want to bring this paragraph here. Equal access to healthcare is a right to be guaranteed in the EU, and this raises the question of why professional language provision in healthcare is inconsistent or at worst absent when these services do exist and are essential to ensure quality and equality. Ensuring equality. So what we have learned so far is that communication among culturally and linguistically diverse participants, and I'm careful with the language because I wouldn't say speakers, because that wouldn't not include sign language users, so participants in interaction is complex and multidimensional. Culturally and linguistically diverse participants are the norm rather than the exception. If we go by how we are moving these days, how people are displaced, and the frequency of interactions, they make these intercultural and interlinguistic interactions the norm. Professional interpreters, however, do not constitute the majority of interpreters brokering communication. We can simply look at the amount of registered interpreters in professional directories and look at the amount of interactions, and we can see the numbers. And access to information continues to be enabled by translators and interpreters and other forms of language mediation. And a language industry fills a gap. But in filling that gap, in trying to do it immediately, some skills may be taken at face value. When we ask about how do you test your interpreters or your volunteers, sometimes there is no test, and sometimes that means skills are taken at face value. So this looks like not a very happy picture, but it is a real one. And the question is, how do we move forward? What can we do from here? There's no question that translation and interpreting is allowing speakers of different languages, users of different languages, to access information and services. So how do we move forward in meeting communicative needs reliable? And this is where I think academia, government, NGOs, and industry need to all come together. And we have made many efforts, and every sector has made many efforts, but we are still struggling with the issue of quality. So I don't have a magic answer, and I'm not supposed to, but I'm just highlighting the need for measuring rather than taking at face value whether those are language skills or interpreting skills or translation skills, and educating, training, and designing materials that are relevant, that are empirically based, so that if we have the chance of one-day workshop or a month course or a summer school or a degree, we can prepare the participants who may not be able to afford a university education all the way through in a way that's going to be meaningful for them. And I cannot not mention that as the need for translation, interpreting, language mediation is more pressing than ever, we have already turned to artificial intelligence for help. So machine translation has proven very successful in certain areas and not that successful in others. Google Translate is doing what Google Translate can according to how we feed Google Translate. So what do we do? And I'm working with Pepper, for example, and Pepper is monolingual, and it's not his fault. And he has an amazing memory. So how can we engage Pepper? How can we engage artificial intelligence in our cause? And this means, how do we take a lead rather than we being brought to the table at the very last minute, when there is no other thing to do than to listen to this professor who wants to tell us about intercultural communication. So how do we take the lead? And here's how I have conceptualized. This is my opinion. It's the only piece in the presentation that's opinion. But if you look at this is a glove with sensors. And what scientists are doing in artificial intelligence is asking us to wear these gloves and to collect data on how we do things. And there is no question that automatic movements are really well done. They are very difficult. Pepper still cannot hold hands in the way that we would expect a human person to hold a hand to show empathy, for example. But for grabbing the pointer, this is what I'm doing. So this is very mechanical, it's very predictable, it can be done. So it's studied and we are succeeding on that. Artificial intelligence has also been moving along, now going from binary and going from neural to understanding natural language processing. You see the traffic light in green there. Social robotics is more and more active these days, which means human-robot communication still has a long way to go, but there are advances. Bringing in intercultural communication also as perceived between a robot and human, but in interpreting and translation, we have seen the results of common daily interactions in Google Translate, and I'm not putting Google Translate down, I'm just saying it still needs to go. So, to end on a happy and optimistic note, what can we do? Why don't we take the lead in bringing translation and interpreting research to the table? And I'm suggesting an agenda that's by no means complete. But taking part in interdisciplinary endeavors, contributing knowledge, raising awareness, advising on risks. We don't need to do the project if we are not interested, but at least we need to be there, and we need to be pointing out the issues that when people are concerned about building designing a program or whatnot, they may not have the expertise on intercultural communication that we have. So it is our role or our responsibility to point out the issues, to help, etc. But to be asked or to decide to go and be heard, even if we are not asked to be at the table. Replicating human-to-human interaction, for example, in the case of what I'm trying to do these days, requires time and effort, especially as interdisciplinary teams may not have a common language. It takes a long time to explain why communication is what it is. And why is that? Because we all have languages and we all communicate. So I always remember Ted Higgs, when I was studying second language acquisition, saying, no, we all have hands, we are not all pianists. And yeah, it's obvious, but however, we forget. And so when people have language, they think, I don't need an expert in language, in translation, interpreting, and intercultural communication, because I also communicate. We know that, for example, in the project I'm working on, building databases, inventories of functions and interactions that are contextually bound, culturally bound, differentiating and prioritizing different types of functions take negotiation. Because if we want a program to act as a counselor, let's say when people have fear of heights or fear of flying, and we want to activate a virtual aid or support, software developers and artificial intelligence experts focus on one area, we focus on others, therapists focus on different ones, and it takes a long time. We are not speaking the same language, so we also need to factor that and take it into account. In addition, in culturally and linguistically diverse interactions, one size does not necessarily fit all, which is what we are expected to do, and certainly not all the time. So I think expertise in translation and interpreting is central in bringing together speech communities, and why not we lead the way? And with that, I'm closing so that we can have some time for questions. Thank you very much.
Thank you
We have
so
time
much,
for questions.
Professor Angelelli. That was very enlightening. And I can see that you're very disciplined. You're very disciplined. It was 38 minutes. So we have just a few minutes for questions. Anyone? Yes. Do we have a mic that is going up? Or do we just shout? We shout. Okay, so we shout, and then we speak up, right? And say also your name, Jonathan.
Professor Angelelli, that was a wonderful talk. You were talking about the lack of community interpreters and the need to use AI. Is there not a risk that because community interpreting is already vulnerable, the AI might be misapplied in situations where people are already at risk of receiving poor interpreting?
Thank you for your question, Jonathan, and your volume was certainly higher than the video. So, first of all, I want to say I never suggested that we will use artificial intelligence or we will not use it for community interpreting. So I didn't mean to say that. I meant to give us so I'll go back to the point of already vulnerable parties. I will go back in a minute. But the point is to discuss what do we do with the expertise we have, given the times we're living, and given that this phenomena is only going to be more and more frequent rather than less. And I think the risk of using artificial intelligence is present across settings, for community interpreting and translation, for any kind of translation or interpreting, and that we have to be extremely careful when we decide that we are going to replace a human translator or interpreter by a machine. I'm talking about working together. I'm talking about raising awareness of the risks, of the opportunities, of the challenges that exist when we think that replacing communication with a machine is a direct possibility. And that's why I started the talk with us thinking about language, communication, and borders. Because what happens so far with artificial intelligence is that they see things in this binary way. And that's why I thought, if we think of a continuum, and we all know that what we do is not black or white, we cannot imagine not being at the table when scientists are taking the lead, thinking, if I can have the robot just listen and answer a question, and the problem is the robot is very well at doing mechanical, predictable things, and there's nothing predictable about human interaction or language, human language. Yeah. Thanks for your question.
And thank you for your answer. We have time. Yeah. Was she? Yeah, I saw that one. Was she first?
I don't know. But we can
okay. Yeah. So we'll just take these two questions. Okay. Sorry, but Professor Angelelli is going to be available afterwards. But there was a question up here. Please say your name first and say. In the back. Yeah.
Susan, I just want to know. We all know that there's no one size that fits everything. Why don't we develop a curriculum for every single setting? Why is curriculum not adaptable?
Curriculum is adaptable, and I don't know when you're saying why are we not developing. We are. There's curriculum that exists for legal setting, medical setting, as we have for conference for the longest time, but also for prison, for educational settings. So there is curriculum. It may not be shared across the globe, but that's our fault because we don't make it available.
I see too. There was another one up there. Yes, I know. So you had a question?
Yes. Good morning. My name is Denise Filner.
Thank you.
First, thank you very much. It touched so many things that I'm very, very interested in. My question was about the report that you did for the European community, which obviously highlights enormous gaps. And I just wondered, seeing it was published in 2015-17, whether they came back to you and said, okay, we're going to do something about it, or what's the situation then? Because obviously it's different the situation is different for each country.
Right. In a nutshell, no, they haven't come back, and it's not surprising, but I think the ball shouldn't be on my field, that it is, and I'm going to continue pushing for it. It's an issue of resources and priorities. Yeah. Thank you. And can I take that last question?
Yes, exactly. You just do that.
Yes, Renee.
Hello, Maynard. I want to begin, I think, on the question that was just raised and you answered. And we frame it like this. I very much like your idea of a continuum and of the working agenda. And in terms of politics, I would like to know how do you see the need to put language learning on the agenda? In much of the more political agendas that I see, it's like it's always translation and interpreting are opposed to language learning, which I think, and there are studies, are not. So that's the first part of the question. Second part would be, should we put also arguments on the cost of non-translation on the agenda? It's always about the cost of translation and interpreting, but I think politics should be aware of the big cost, the bigger cost of non-translation. What is your opinion?
Thank you for
a wonderful presentation.
Thank you, Renee. I'll start with the second part of the question. In the study of the EU borders in healthcare, there is a section on cost, and there is a section of social cost of non-integration, etc. So that has been put on the table to compare and contrast the cost of not providing translation and going through all of the consequences. We have read from the hospital in France where we had a mistranslation of the dosage of chemotherapy and 8 patients passed away. So that has been highlighted, and as less costly than providing translation and interpreting. And that's why the conclusion I highlighted, why don't we do it if we know it's available and non-costly? And the part of language learning, yes, when we look at how we understand the other by learning a language and becoming for a little while a person who is not able to. We have done some experiments of bringing in police, healthcare representatives and put them in a situation of a linguistic minority to understand. But language learning, in my view, has always been the first and basic must before we think about a connected world and an intercultural world. But it's true that we know about issues of majority languages taking over minority languages, and that's a problem. So we need to raise awareness on that. When I say we should be at the table and we need to be talking about these things, language learning is one of those. And a very different relationship that language learning has with translation and interpreting these days than it had in the past, when we were thinking of let's get away from the grammar translation and we know now with current research that language is really developing and evolving as we teach translation and interpreting, and it's a wonderful way to tackle language acquisition too. Yeah. Thank you.
Okay. Thank you very much. I'm sure that there are many more questions. It clearly was a topic that caught on, but so since we have a break now, Professor Angelelli is going to be available also during the break and for the rest of the day and ready to take questions. So should we give Professor Angelelli a little